One of the most promising ways to solve the HIV crisis in the U.S. is to use prevention drugs that can stop the virus from infecting people who are at high risk. Prevention drugs for HIV are also known as pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP. PrEP is a daily pill that people who do not have HIV take to reduce their chance of getting HIV from sex or injection drug use. PrEP works by blocking the virus from entering the cells and multiplying in the body. PrEP is highly effective for preventing HIV when taken as prescribed. According to the CDC, PrEP reduces the risk of getting HIV from sex by about 99% and from injection drug use by at least 74%. PrEP does not protect against other sexually transmitted diseases, STDs, so condom use is still important. PEP is a short-term treatment that people who do not have HIV take after a possible exposure to HIV, such as a sexual assault, a needle stick injury, or unprotected sex with someone who has or may have HIV. PEP must be started within 72 hours of the exposure and taken for 28 days. PEP works by preventing the virus from establishing a permanent infection in the body. PEP can reduce the risk of getting HIV by over 80%, but it is not 100% effective. PEP does not protect against other STDs, so condom use is still important. There are 3 PrEP medications approved for HIV prevention: Truvada, Descovy, and Apretude. Truvada and Descovy are pills that contain 2 antiretroviral drugs: emtricitabine and tenofovir. Truvada contains tenofovir disoproxil fumarate, TDF, while Descovy contains tenofovir alafenamide, TAF. Both Truvada and Descovy are approved for preventing HIV from sex for all adults and adolescents who weigh at least 35 kilograms, 77 pounds. However, only Descovy is approved for preventing HIV from injection drug use. Truvada and Descovy have similar effectiveness and safety profiles, but Descovy may have less impact on bone and kidney health than Truvada. Apretude is an injectable drug that contains cabotegravir, a different type of antiretroviral drug. Apretude is given as a shot in the buttocks every 2 months by a healthcare provider. Apretude is approved for preventing HIV from sex for adults who do not have HIV and are at risk of getting HIV from sex with a person of the same sex. Apretude is not approved for preventing HIV from injection drug use or for people who have vaginal sex with someone of the opposite sex. Apretude has been shown to be more effective than Truvada for preventing HIV from sex among men who have sex with men and transgender women who have sex with men. Prevention drugs for HIV are not a cure for HIV, and they are not meant to replace other prevention methods, such as condoms, safer sex practices, and regular testing. Prevention drugs for HIV are only available by prescription, and they require regular medical visits and blood tests to monitor their effectiveness and safety. Prevention drugs for HIV can also cause side effects, such as nausea, headache, diarrhea, weight gain, and injection site reactions. Some people may also develop resistance to prevention drugs for HIV if they become infected with HIV while taking them. Prevention drugs for HIV are a powerful tool to prevent new HIV infections and end the HIV epidemic in the U.S. However, according to the CDC, most people at risk of getting HIV are not receiving prevention drugs. There are many barriers that prevent people from accessing prevention drugs for HIV, such as lack of awareness, stigma, discrimination, cost, insurance coverage, and availability of healthcare providers who prescribe them. To overcome these barriers, more efforts are needed to educate people about prevention drugs for HIV, increase their availability and affordability, and support people who choose to take them. One of the most effective ways to prevent HIV infection is to use prevention drugs, also known as pre-exposure prophylaxis or PrEP. PrEP is a daily pill that contains 2 antiretroviral drugs that stop HIV from multiplying in the body. PrEP is recommended for people who are at high risk of getting HIV, such as those who have sex without condoms, have multiple sexual partners, inject drugs, or have a partner who has HIV. PrEP has many benefits for people who want to protect themselves and their partners from HIV. According to the CDC, PrEP reduces the risk of getting HIV from sex by about 99% and from injection drug use by at least 74%. PrEP can also help reduce the stigma and anxiety associated with HIV and improve the quality of life and well-being of people who are at risk. However, PrEP is not a magic bullet. PrEP only works if it is taken as prescribed, and it does not protect against other sexually transmitted diseases, STDs, or pregnancy. Therefore, PrEP users should also use condoms and other prevention methods to reduce their risk of getting or transmitting other infections. PrEP users should also get tested for HIV and other STDs regularly and follow up with their healthcare providers. PrEP is a safe and effective tool that can help end the HIV epidemic in the U.S. However, many people who could benefit from PrEP are not aware of it or do not have access to it. According to the CDC, only 23% of people who were eligible for PrEP in 2021 received a prescription for it. There are also significant racial and ethnic disparities in PrEP use, with Black and Hispanic people being less likely to receive PrEP than white people. Therefore, it is important to raise awareness and education about PrEP among people who are at risk of HIV and their healthcare providers. It is also important to address the barriers and challenges that prevent people from accessing PrEP, such as cost, stigma, discrimination, and lack of insurance or healthcare services. By increasing the availability and uptake of PrEP, we can prevent thousands of new HIV infections and save lives. Prevention drugs for HIV are medicines that can reduce the risk of getting HIV from sex or injection drug use. The most common prevention drugs are pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP. PrEP is a daily pill that people who do not have HIV take to prevent getting HIV. PEP is a short-term treatment that people who may have been exposed to HIV take to prevent infection. Prevention drugs for HIV are highly effective and safe, but they are not widely used by people who need them the most. According to the CDC, new HIV infections declined 12% from 2017 to 2021 in the US, but most people at risk are not receiving prevention drugs. There are many challenges and barriers that prevent people from accessing these life-saving medicines. Some of these are: lack of awareness. Many people do not know about prevention drugs for HIV or how they work. They may not know their HIV status or their risk of getting HIV. They may not know where to get tested or how to get a prescription for prevention drugs. Stigma. Some people face stigma and discrimination because of their sexual orientation, gender identity, race, ethnicity, or drug use. They may fear being judged or rejected by their family, friends, community, or healthcare providers if they seek prevention drugs for HIV. They may also worry about being labeled as promiscuous or irresponsible. Cost. Prevention drugs for HIV can be expensive without insurance or financial assistance. Some people may not have health insurance or may have plans that do not cover prevention drugs. Some people may not qualify for public programs that offer free or low-cost prevention drugs. Some people may not be able to afford the co-pays, deductibles, or other out-of-pocket costs associated with prevention drugs. Insurance coverage. Some insurance plans may have restrictions or limitations on covering prevention drugs for HIV. For example, some plans may require prior authorization, copayments, or limits on the number of pills per month. Some plans may not cover the lab tests or clinic visits that are needed to start and continue prevention drugs. Racial disparities. There are significant racial and ethnic disparities in HIV prevention and care in the U.S. Black and Hispanic people are disproportionately affected by HIV and face more barriers to accessing prevention drugs than white people. For example, only 11% of Black people and 21% of Hispanics who face a high risk from the virus received PrEP in 2021, compared to 42% of white people. These disparities are driven by factors such as poverty, lack of health insurance, racism, homophobia, and mistrust of the healthcare system. These are some of the challenges and barriers that prevent people from accessing prevention drugs for HIV in the U.S. To overcome these obstacles, we need more education, awareness, and advocacy for prevention drugs among people at risk and their healthcare providers. We also need more policies and programs that make prevention drugs affordable, accessible, and acceptable for everyone who needs them. Prevention drugs for HIV can save lives and help end the HIV epidemic in the U.S., but only if we use them.